Again, today there are no new cases of Covid-19 to report, so our number of active cases remains at 22, and all of those cases have recently returned from overseas and are or were in managed isolation. There is one person who remains in hospital stable on a ward. That is in Auckland City Hospital. And just to reiterate, no cases of community transmission. So our total of confirmed cases of Covid-19 remains at 1,178, the number we will continue to report to the World Health Organization. Yesterday our labs completed 4,530 tests, and we have now surpassed over 400,000 tests, with 402,000 tests having been processed since we started testing for Covid-19 back at the beginning of February. And just to put those case numbers in context, you will have heard overnight the Anthony Fauci from the USA talking about the possibility of 100,000 new cases per day in the USA. That would be the equivalent in New Zealand of around 1,500 new cases per day, which is more than the total number of cases we have had since the start of this pandemic. So worldwide, the number of cases continues to increase, and we're seeing, of course, resurgences in some countries where controls, including lockdown controls, have been relaxed. And obviously yesterday's developments in Victoria in Australia, particularly in those suburbs in Melbourne, where they have reimposed some conditions around people's movements, are a reminder that community transmission in the future is a real possibility, and we may here need to take measures to local measures to counteract community transmission if it occurs again. We will be watching carefully and continue to work on a daily basis with our Australian colleagues to see what's happening there.
To avoid a second wave of Covid-19, we must continue in a phase of being on guard, a point that's been emphasised in recent days by the Director General of Health. While our collective goal since March was to stamp out the virus and come out the other side of lockdown as quickly and as safely as we could, which we achieved, our goal must now be to preserve those freedoms. And we all need to start doing as much as we can to manage the risks as the virus grows around the world. While we do not have community transmission of the virus, while we have low cases and days with zero, Victoria too was in a position of low cases and days with zero just 3 weeks ago. In the past 24 hours, it has had 64 new cases and today moves to local lockdown across 36 suburbs and has closed its borders. It is an example of how easily the virus can take hold again and why vigilance is so important. It is a good reminder that New Zealand is currently a safe haven in a very dangerous world. But we are not immune to what is happening in the rest of the world, and we will all battle this global pandemic for some time to come. For the government, that means at our borders, we have a plan to scale up resources, ongoing testing regime, and capacity to manage the risk of COVID arriving from overseas. And for all New Zealanders, it means remaining on guard. Today, I just want to give a reminder to New Zealanders of the steps everyone should be taking at level 1. Firstly, do keep a track of where you've been using the government's COVID Tracer app. So if we need to contact trace you, we can do so quickly. And for those who don't have phones that have that capacity, keep a manual journal of the places you have been. If you're sick, stay home. Get advice from your doctor or healthline about getting a test if you're symptomatic. Maintain good hygiene, such as washing and drying your hands and catching your coughs and sneezes. But again, you should be staying home if you're unwell. And to New Zealanders who the Ministry of Health is contacting or has previously been contacted in the past days, particularly those who have had more than 5 calls unanswered, do your bit, get back in contact. It's a small thing that you can do as a member of our team of 5 million. And finally, to our fellow Kiwis who are returning home, they now are joining our team. Many will have had tough times in offshore places, and we should be welcoming them back. I repeat, the elimination of COVID is not a point in time, but a sustained effort, and the job is not done. It will not be done for some time to come. It relies on all of us remaining vigilant, being prepared.